Over 8 million people are living with HIV in Asia. In 2004, more than 1 million people found out they had the virus. Half of these were under 24. HIV and other sexually transmitted infections are at a crisis point for kids in Asia. But it's a crisis that they themselves are responding to, and their work is succeeding. Simran Udas is a 20-year-old student and part-time radio presenter from Nepal. She plays a mix of Western and Nepali music, as well as hosting chat shows. But she also works for RIA as a peer educator, telling local kids about reproductive health and safe sex. The RIA program all over Asia relies on volunteers like Simran to get the message out.
RIA program is mainly related to reproductive health, especially for the youth. I can give them information without any hesitation.
In Simran's hometown, RIA has funded a youth information centre.
This is a youth information centre. This is a very friendly environment. Their main target to come over here is not only for the enjoyment also, but to have a discussion and sharing the ideas. They can take the condoms from here. In Nepal, most of the community are same like this one. The major problem is the economic problem, so that they don't have money, so that they can invest their money on their children's educations.
Simran knows that education is going to save lives in Nepal and in other countries where RIA works. In these places, young people lack information, condoms, and access to sexual health services. RIA fills the gap. But poverty, ignorance, and very traditional social attitudes means that this is no easy task. Most young women in Asia lack the freedom to make some basic choices.
What they have to face is they have to really struggle with their parents, with the society. If they will be choosing a husband whom their parents have not chosen for them, so they have to be aparted from their family, with the society.
The consequences of going against the wishes of the older generation can be devastating. My boyfriend and I had a baby, and my parents didn't approve. He went abroad and left me, and my parents said, "We can't take you in our home now. You have to lead your own life now. Do whatever you have to do." I didn't have any way to support my daughter, so I found a guest house where they let me work as a prostitute in the daytime, and at night I care for my daughter. Women across Asia lack the same education and rights as men do. In their search for a better life in the cities, they may find their choices are very limited.
Everything is fake. Karma ekle huda rap videos in the day. Juko feud shot, bottom shake. Okay, huncha floss. Heavy metals, no Beatles. Condom bina brothels, bad girls saruchan in the highway motel. Prostitution, drugs, any addiction. HIV, hepatitis ko fatal infection. Ma esto chu, ma testo chu.
In my village, there was a girl who used to live in Kathmandu. She said we should all come here and get good jobs, but I ended up here. If I had known that I could end up in such a bad place, I would never have come. The whole day, we dance till 10, go back home and sleep. There is a feeling of emptiness. A lot of girls have gone into sex work. There is nothing happy about my life. Sex work directly contributes to the rapid rise in the number of women throughout Asia living with HIV and other sexually transmitted infections. From Nepal, many women are tricked into sex work in India, where HIV rates are far higher.
trafficking is very much a big problem in this community because most of the girls, they are being trafficked to the India. Uneducated girls, they see on the board also that they are going to the India. They cannot even read also that this is the India or something like the place. This is the biggest problem, trafficking in this community. The society also, they see them in negative sense. Okay, this girl was trafficked on the India and maybe she has got a disease or HIV/AIDS or something like that. So they are treated very badly.
Cambodia has similar problems. Over 50,000 women and children have been sold into sex work in the last 10 years. Sex workers can have little power to insist on safe sex. But it's not just sex workers who are at risk from disease. Most new HIV infections in Asia occur when men buy sex, and many do. They then have unprotected sex with their partners, another reason why Asian women are so at risk from HIV. There are two main problems facing the people I work with. For the women, they get married very young, sometimes as young as 14, and they don't know much about sexual health or their own bodies. But the men, even when they are as young as 15 or 16, they already go with commercial sex workers, and often they don't use condoms. In Phnom Penh, the capital of Cambodia, RIA funds the Condom Cafe. Located in the main red light area, it targets those most at risk.
We provide youth-friendly services to our target group, who are the youth in the high-risk groups, such as prostitutes, and they need our help to provide information about safe sex, and especially to provide youth services for them because they face many risks.
The Condom Cafe provides counselling, testing for HIV and other sexually transmitted infections, treatment and drugs where needed, as well as information, training, and of course condoms.